significant setback in the health sector could undo progress made in the fight against HIV in the country. On Tuesday, the Trump administration took action to suspend the delivery of life-saving medications for HIV, malaria, and tuberculosis to countries receiving aid from USAID. A memo sent to USAID contractors and partners ordered an immediate halt to their activities as part of a wider freeze on U.S. assistance. Our reporter Florence Lee provides more insight to that story.
Health Cabinet Secretary Deborah Barasa has stated that the Ministry of Health is carefully reviewing areas that may be impacted by the recent executive order sent by the U.S. President Donald Trump to determine appropriate actions. Barasa emphasized that Trump's decision to reassess U.S. global health policy serves as a wake-up call for African nations to focus on local solutions. Key areas affected by Trump's executive order include AIDS relief and TB funding. Speaking at the East Africa Region Global Health Security Summit, Barasa also highlighted that COVID-19 pandemic has underscored the necessity for African countries to strengthen their healthcare systems.
This summit is a call to action. It is a call to move forward and translate our commitments into tangible results. Let us embrace the spirit of partnership and solidarity as we work towards a common goal. A region that is better prepared, more resilient, and capable of withstanding future health challenges.
The summit participants discussed the critical need to address gaps in healthcare system, such as a shortage of trained professionals, outdated equipment, and inadequate infrastructure.
It's also an opportunity to begin to look at the workforce, where we have critical gap. As we are all aware, there is no health without workforce. So hence the need for us to really use this opportunity to revisit that agenda of strengthening the health workforce as far as the East Africa region is concerned.
We all know the environment we are in, the context we are in, so it's critical to strategically think about ways of mobilizing resources, securing resources to make sure that our health challenges are addressed.
We have equipped over 110,000 workers with devices that have been manufactured in Kenya. That also represents another critical pillar: local manufacturing, local jobs, and also affordable devices that can be put in the hands of health workers to allow them to provide healthcare universally across the country seamlessly.
We need to have resilient systems. This includes having universal health coverage that is affordable, accessible, quality care to all, as well as having components of health security strengthened.
In response, the Ministry of Health has pledged to develop a comprehensive plan for the interventions, which will be presented to the Cabinet and His Excellency the President of Kenya for further action. Reporting for Tandao News Outlook at 1, I'm Florence Simeo.